everybody, it's Becky with ChiroUp. I am excited that you're joining me today. If you'll give me about 20 minutes of your time, I'm going to walk you through the entire platform, show you how to use ChiroUp. You can get fully implemented as soon as you're done watching the video, and so that you can start using it and ChiroUp will start working for you today. So let's go ahead and get started. I do want to note a few things. Underneath this video, there's a timestamp library so that if you want to jump to a certain component that I'm going to demonstrate for you, you can do so. Another thing that you can do is open up your ChiroUp in a separate window. That way, if you're watching this video, you can pause the video, jump into your ChiroUp, try out what I'm showing you, and then come back and finish watching the video. The best way to learn ChiroUp is to use it. So we really want you to get started. And with that being said, let's jump right in. This is your dashboard when you first log into ChiroUp. So your numbers take about 30 days at least to populate. The reason for that being, these will auto-populate for you, but they're based on a 30-day survey that goes out after you send out a condition report to your patients. So I don't want to get too far ahead of ourselves, but just know that your dashboard right here is going to automatically fill in. It's based on that 30-day survey. If you ever see a number that you don't like, click on that little boost button and it's going to give you some ideas on what you can do to improve the number. Okay, underneath those, and we will talk about that more in a few minutes, MD relationships. So when you're creating those condition reports, you can easily create initial reports and then go back in later and create a release report for their patients' other healthcare providers. That way you can really generate more referrals, build relationships with other healthcare providers in your area, and also keep track of referrals from those healthcare providers. Again, we'll talk about that more in a few minutes. Your Google reviews will help you to automate those. We'll talk about that. Facebook engagement so that you can see any recent likes on your Facebook page. And then our weekly blog will show up on your dashboard. You'll also see it in your email, but be sure to check it out because there's so much awesome clinical information in there. You can even share that with your other friends who are chiropractors who want to get some more information and who aren't ChiroUp subscribers yet. Research reviews. So one thing about ChiroUp is that we will keep you up to date on all of the latest research. One way that we do that is just dropping in research nuggets every day. So just about every day you're going to see a new article here in Research Review. If you see it, but you don't have time to take a look at it, you can always click here on Read More. That allows you to either search for a previous article or just scroll through our recent articles. But they're really just nice. They're simple 5-minute reads that's going to help keep you up to date. But a better way to do that is through our clinical skills. So if you'll notice this menu here on the left, this is our navigation menu. So I'm going to be referring to that a lot. Clinical skills first, these are all expandable. So click on clinical skills and then we're going to go into condition reference. Condition reference is where you're going to see over 100 of the most common chiropractic conditions that you would see in your office. They're listed alphabetically. You can also do a search for a specific condition by searching for the clinical name, or you can search for the region if you're just not sure which one you want to take a look at. So we'll pull up our shoulder conditions, and then I'm going to go ahead and click right here on rotator cuff strain. Now, anytime that you click on any of these clinical conditions, you're going to get videos for the best evaluation tests, the best soft tissue management, as well as the best exercises. These are all videos for you to reference. So if you want to take a look at one of the best evaluation tests, maybe you're trying to decide if it is that diagnosis or not, you can click on it to look at the information about the evaluation tests. And then you can also take a look at how to manage it, as well as exercises that would be currently recommended for your patient with that condition. Underneath those videos is all of the research that backs it. So we have the research subdivided into categories that you can take a look at individually, or if you just want to click here on Expand All to view the entire article and scroll through it. What's nice about our condition information is that we keep it up to date. So it's not just like a textbook. Anytime that any new information comes out, we'll update the article, update the videos, and then you'll notice where we get that from. So we have all of your references for you underneath the article. Again, these stay up to date so that anytime that we put new information in, we'll drop that reference in for you so you know exactly where it came from. We'll even update the videos for you. So this is a really great way to keep up to date on those protocols without having to search online, without having to consult an out-of-date textbook. This is all up to date for you. We even have a notes section, so if you click there, if you go to a CE course, or if you run across an article that you find is interesting, you can actually keep notes per that condition and save all those notes so that you can just jump into that condition, take a look at the research as well as your notes as well. Okay, so that's for your reference, and that's for all of the providers or staff in your office that you want to have them keep up to date on those protocols. Now, in order to get this into the hands of your patients, I'm going to show you the quickest and easiest way to do it. Keep in mind, we can train your staff so that it runs seamlessly in your office so that they can create reports for you based on the information that you provide, however you want to do it. But like I said, right now, I want to show you the easiest, simplest way to do that. So it all starts with search patients. That's where you can look for your patients as well as add patients to your patient database. So you'll just go up here to this gray search patients box, and then you can start typing in your patient's last name. If they're already in your database, you can click on that patient's name. If not, you can click right here on Add New Patient. That's how you're going to put a new patient into your database, or your staff can put your patients in for you. And then it'll say that last name that you are searching for. We're just going to put in a patient's first name. Let's also go ahead and put in a patient's email address. We'll just put in that one. And then if you're the provider, this primary clinician will auto-populate for you. If you're not, that gives your staff an opportunity to choose the provider that is sending that report out so that your patient knows that it's from that provider that they saw in office. You can also put in text messages so that you can request additional information. You can also send out surveys for them as well. What I'm going to do right now is I'm going to click on Create so that our patient is now in the patient database. And then we're going to go ahead and click right up here on Create Report. So you're going to notice how quickly and easily I can create a report and send it to the patient. Remember, we want to keep our patients well informed so that you have better complying patients who become better referring patients, who have better clinical outcomes for you. It all starts with this condition report. So, condition report for Robert Smith, we're going to choose the region of pain. We're going to say shoulder, and then we're going to choose rotator cuff again. Let's go ahead and do that. Everything pre-populates for you. You're basically finished. You don't have to do anything else to complete this report except send it to the patient. The one thing that I am going to do though before I show you what this report looks like is I'm going to go ahead and choose a healthcare provider. Now what this does is it's going to create an initial report for your patient's other healthcare provider. So again, you can keep in touch with them, get more referrals, build that relationship with them. So chose the region of pain, name of the condition, we added in a healthcare provider. Now we're going to click on Save. Now from here, this saves a report to the patient's profile. I'm going to go ahead and click on Print so that you can see what this report looks like. We're going to come back in a few minutes and I'm going to show you how you can edit that report and customize it for your patient. But right now I wanted you to see how quickly and easily you can create a full report and send it off to your patient. So the first thing that you'll see here is your letter for your healthcare provider. It has your clinic logo here at the top and then just a nice short explanation, diagnosis, treatment plan, and any goals that you have for your patient. This is really meant to make a great impact on that other healthcare provider. It's short and sweet. It doesn't waste anybody's time, and they know that you can treat that condition and that they might want to send a patient over to you. Your clinic information is down here at the bottom, and then this is what your patient gets. So your logo here at the top. Now, whether you print this or whether you email it, it's going to pretty much look like this. The condition is written in a 6th grade lay language for them, so it's really easy for them to understand, kind of go back over. Treatments that they would expect to receive in office so they know exactly what's going to happen when they come in to see you, how often you want to see them, any goals you have for the patient, and then finally their ADLs, so what they need to do at home to get themselves feeling better. Now, here is where they can see exactly exactly their videos that they need to get themselves out of pain quickly and easily. If this is emailed or printed for your patient, they'll get a thumbnail with a written explanation on how to do those exercises. If it's printed for the patient, they'll actually have a QR code that they can scan and download that app and be able to view those videos. They can also just navigate to this website. It's got their username and password and temporary password here. If it's emailed to the patient will actually have an orange login button that they can log in directly from their email that they open from you. Let me show you what this patient app looks like, though I have it open in another window. So the patient, the very first time that they go to log in, is going to have to agree to the terms of use. Easy enough. And if they want to read through it. And then once they've agreed to their terms of use, your logo is going to be here at the top, and then the patient is going to have the list of their exercises. So this is specific for that patient. They can watch the video, go to the next one after that. When they've completed their exercises for that day, they can actually notify you that they've been completed, and then also let you know what level of pain they were at when they actually completed those exercises. I'll show you where you can access that in just a few minutes. The patient can also view their ADLs while they're in their app, so if they need to see what they need to do at home, condition information so that they become, again, well-informed patients who become better complying patients who get better clinical results, and more referrals for you. And then also your clinic information, so they know exactly how to get a hold of you, especially if they have it in their app. And then their settings, that's where they can go ahead and log out. But this is the patient app. So you can see how simple it is for them to follow along with their exercises. Now, let's go back to the report builder. Now, if you remember correctly, we put in the patient's name, so we created the patient in your database, and then all we had to do was choose the region of pain, name of the condition, add in that healthcare provider, and we got that full report. You can customize these reports however you would like. So I'm going to show you quickly how you can customize a single report, and then in a few minutes I'll show you how you can customize a protocol on the back end. This is that report that we created. If you need to add in a secondary or tertiary diagnosis, you absolutely can. You can put in whatever you need to cover all of your patient's conditions. The protocols for each condition will automatically populate. If there's something listed that you're not going to do, it's really self-explanatory on how to take care of it. Just go ahead and click on the X. It'll take it out. If you want to add anything in, just click on the plus sign. You can add whatever you would like to that report. Let's go ahead and add in an ADL as well. Your exercises, same thing. So all your exercises are listed. Again, self-explanatory. If you want to take one out, just click on the trash can and it'll delete it out of the patient's report. If you would like to edit that exercise for the patient, so your sets, your reps, or your frequencies, you can do that. And you can even take a look at the video by clicking on that play button. So if you need to refresh your own memory on how to do that exercise. Your in-office visit schedules can get changed as well. You can change the frequency. You can change the length of time in between. So 4 times, let's say, a month for 2 months after that, or if you want to do 4 times a week, whatever you need to do. You can even add in a second row if you need to. Your key exam findings, this is a free form for you, so if you need to add anything else in, you can. You can also set goals for the patient, so their percentage of improvement. You can also expand to where you can add in disability questionnaire scores. You can add in additional goals if you would like to. Walk across the room without your cane. You can even add custom sections into your patient's report. So if you have your very own section that you want to add in for that patient, you can go right ahead and do that as well. That healthcare provider summary letter that I showed you earlier, this can be sent to anybody who's involved with your patient's healthcare. You can click here on Preview Summary, And then you can edit it wherever you would like. If you're going to send it to a trainer, to a coach, to a client, you can treat it like a basic Word doc and put in your client, your athlete, so that it reflects exactly who you're sending it to. You're going to watch those referrals fly in. Your attachments, you can attach PDFs to your condition report, and you can send out surveys with your condition report as well. So that's how you're going to customize a single report. And if you would like to, go ahead and pause the video now and try that out on your own. You can put yourself in as a patient. Remember, you want to start at that search patients box up at the top, put yourself in as a patient, and go ahead and send yourself a report, and then come back and let's carry on. All right, so from here, I'm going to scroll back up to the top, and then we're going to go into Robert Smith's profile in your database. So we'll click right here on the patient's name. A couple of things that I want to mention from the demographics page. You'll notice the Gmail address. So that's going to help you to automate Google reviews. You can check on our help page on easy ways to automate Google reviews. But if you can get a Gmail address from the patient, it really helps, because that way your patient's already logged into a Google account. They don't have to sign into anything else to be able to leave that review. And it's just a really excellent way to kind of automate that in your office. Also on the patient's demographics page, if you click here on edit, you can add in anything else for your patient that you would like to. And that's also where you can go in, that's also where you can go in and reset their password if you want to right here. Okay. So from the demographics page, we're going to start on exercise history, and we're going to work our way backwards. So from exercise history, actually, you know what? I'm going to pull up a different patient here so that you can see one that's already kind of filled in. So we'll just pull up a patient and go into exercise history so that you can see their history of when they completed their exercises, and also when the patient's in their app and they let you know what level of pain they're at. This is where you can see that as well. So you'll see the dates that they completed exercises and their pain level. Exercise prescriptions. Whoops, let me do this now. I pulled up somebody that doesn't have anything in their prescriptions. So let's pull up this one. Oh, there we go. Okay, so you can take a look and see what's in the patient app. So if at any time you would like to take any of those out or update their exercises that are currently displaying in their HealthCom app, that's where you can do it without having to create a full new report. Also under communication is where you can go in and see what days you sent out reports to them, if they've completed any 30-day surveys for you, if they've completed any disability questionnaires for you, and then you'll be able to go in and take a look at all of that information. So you can even create release reports from here. So if you click on release report not created, that gives you the ability to go ahead and send it out. You can put in the number of times that you saw your patient for, their overall percentage of improvement, and then you can generate that letter. So now you've got a follow-up letter to send back to that healthcare provider. Again, completely customizable. Treat it like a Word doc so that if you're sending it back to that trainer or that coach or that attorney, you can edit it so that it reflects exactly the audience that you're sending it to. And then you can really get some good referrals from them as well. Okay, so that is the patient profile and how you can customize single reports. Now what I want to show you is how you can customize a protocol on the back end. So we're going to go ahead and go back into condition reference, and then we're going to click, let's just click here on Achilles tendinopathy. All right, so let's say that you have a protocol that you would like to add into your patient's condition report so that every time either you or your staff create a report, it automatically fills in with your protocol. This is where you would do that. So you basically pull up the condition, you click here on edit, and then you can edit anything else that you would like in that report. So if you would like to edit the lay description that your patient reads, go ahead and do so. If you go into management and then you change anything here, so you're basically going to edit it kind of the same way that we did the patient report, only now when you save it, it saves your protocol. So let's go into edit condition, and then we'll let's see, we're going to add, actually, let's take out modalities. We're going to add in backpacks. And then you can also add in any exercises that you would like to as well. Once you finish doing that and you click here on save, it gives you a couple of choices when you save it. So you can save it for you. You can save it for your whole clinic. If you're assigned to a few clinics, you can choose which ones you want to send it to or which ones you want to set it as your default to. So you have lots of choices, but this ensures that every time that you create that report, it creates it the exact same way that you want it every single time. You can also, in condition references, add in new conditions. So if there's a new protocol that we don't have listed that you want to create, you basically have a blank slate so that now that becomes a choice when you are looking to create a condition report. You can also edit anything else that you would like to as well. So you can edit out your exercises. If you would like to put your own video in, you can certainly do that. Maybe you like this exercise, but you don't necessarily like the video that's with it. So you can go in and you can actually edit it. You can replace the video, take this one out and put your own in, and then your patient has access to that video just like they have access to all of the other videos that are already in ChiroUp. You can go into your ADLs. You can either edit an ADL, you can add an ADL, whatever you need to do to really make it your own. And even in the treatment descriptions, you'll notice, for instance, under acupuncture, it's kind of a general description. If you do something very specific in your office and you want your patients to know about it, then go ahead and edit it out so that it reflects exactly what you do in office. And we really want you to take advantage of this because this is what makes ChiroUp yours. This is how you can really get your message of excellence out to the people that matter the most. So don't be afraid to customize anything. You can also always revert back to the original if you decide that you don't like it and you need to revert back. All right, so that is all under clinical skills. I'm going to collapse that. Okay, now we're going to go into admin. The first thing that you'll see in admin is your healthcare providers. This is going to be where you or your staff can add in those healthcare providers that you're going to be sending the initial and release reports to. It's just a good database so that they're already in there, and think outside of the box. It doesn't have to be, like I said earlier, just MDs or trainers or coaches. It can be any specialty. If you have an eye doctor who your patient saw for headaches and maybe they didn't need new glasses, but they still came to you for headaches, you can still send a report over to that eye doctor so that they know that you can treat headaches. The next person that comes in with those headaches, they can send over to you as well. So just kind of thinking about who you can add into that healthcare provider database. Okay, under your patient access log and your condition report log, these are going to be chronological orders of patients that anybody in your office has accessed that day in ChiroUp, and then also condition report logs so that you'll be able to see any condition reports that were created that day or that you guys opened up that day that you need to go back in and finish. So those are there really for good convenience so you can make sure you get everything done for the day in ChiroUp. Provider statistics and clinic statistics. Okay, so if you think back to this beginning of the video when we started off on your dashboard and we talked about that 30-day survey that would go out. So this is where you're going to be able to see those individual results of those 30-day surveys. So you're going to look up a condition in your clinical skills, right? And then so that you can be sure you have the best diagnosis. Then you're going to create a condition report to send out to that patient. 30 days after they get that condition report where they have been doing their exercises, they're accessing their patient app or logging into their patient app so that they can be sure that they're participating in care. Now they're going to get that 30-day survey so that you can see your clinical outcomes. It's a 4-question short survey asking them about their likelihood to refer, their level of improvement. Your dashboard is going to give you those overall results. Provider statistics, you can take a look at and see where you're having your best successes, per condition. Mine says NA because mine are all sample patients and nobody's filled out their 30-day survey. Yours won't though. You're going to remind your patients to fill out those surveys so that you can not only see what your results are, but you can compare them with ChiroUp averages. So we have subscribers worldwide who are using ChiroUp. Patients all over the globe are using ChiroUp to get themselves out of pain as quickly as possible. This is where you can take a look and see what are they doing or how are they doing compared to what your success is so that we can all learn from each other. ChiroUp was built by chiropractors for chiropractors. We're constantly asking for feedback from our subscribers. So share with us. Let us know what you do differently. If you see that yours is at 99% and ChiroUp's at 75%. Let us know what you're doing so that we can incorporate that care as well. Clinic statistics, that will give you per provider in your clinic where you're having your best successes, again, per condition. So again, really keeping track of those patient outcomes so that you can market yourself out to the public. That is what we use our practice resources for. So under practice resources, marketing campaigns, we have campaigns really built for you so that you can reach out to other providers in your area. Medical physician marketing is a step-by-step kind of game plan on how you can do that marketing, how you can use your areas of success to really market yourself to get more referrals in your office and become one of the top providers in your area. All of the handouts underneath you can use as printed form. You can use them as electronic form. We can do customizations for you. We can put your logo in on those forms. If you want us to put any additional information, just let us know, but those are going to be your marketing resources as well. Your forms library is stocked full of everything that you're going to need to run a successful business. Exercise menu and condition menu. That's what we utilize to train staff. We do have free staff training, so be sure to take advantage of that so you can really streamline ChiroUp in your office. Business forms, have your office manager take a look through here, see what kind of business forms you need. We have office procedures, we have employee handbook, references in here as well. We keep these up to date too, so anytime that there's something that you guys need in office, we're going to drop it in here for you. If you need a form and you can't find it, let us know so that we can either find it for you or we can send one over or drop it into our forms library. Clinical forms as well. All of your impairment questionnaires are in here to take a look at so you don't have to Google online for those. These patient handouts are fantastic infographics for your patients. So just really great stuff here for you that you can use as an attachment on your condition report. If you would like to use these and tape them up on the backs of your treatment room doors, go ahead. If you want to send these out electronically, let's say you're sponsoring a little league team and you want to use this infographic to get some patients in, we can drop your logo in here. You can hand these out to the parents. Whatever you need to do, just kind of thinking about what you can use in ChiroUp where you're not having to design it yourself. We've already got it for you. All you guys need to do is just take advantage of it. And then let's see, our Chiro Finder. This is an excellent way if you have a patient maybe who is going to Arizona for the summer or for the winter or to Florida and you want to find a great chiropractor for them that uses ChiroUp, search the zip code that they're going to, or if it's somebody close, and then you'll be able to find other ChiroUp providers so that your patient can continue getting excellent care even when they're not right there with you. Okay, our help page, actually, let me go back really quickly. I want to point out a couple of other things on here. This little megaphone right there, that's going to give you an area where you can provide feedback to ChiroUp. As I said earlier, we are built by chiropractors for chiropractors. So anytime you have a suggestion or if you see something, maybe an exercise link that might be broken, or just drop that in there for us and we will take care of it. This little bell is your alerts for the day. So be sure to check that out every day so you can see what reports were sent out. You can see if anybody filled out a survey. You can take a look and see what they said on their surveys or their disability questionnaires as well, but that will be per day so that you can take a look in here. And then also this little person icon, that's where you can go in to fill out clinical, update your clinic information or provider information, update your billing, whatever you need to do. But As I said earlier, the best thing about ChiroUp is that we have free, unlimited live support. That means that if you want to, you can click on our help page. You can jump in and let's say you want to search for something, how to create a condition report. Easy as that. It will give you, whoops, as soon as it loads, it will give you some screenshots so you know exactly how to do that in ChiroUp. But you can also email us, you can call us, you can chat with us online, you can schedule a call with your success manager so that you can get all of your questions answered. We really want to help ChiroUp, or we really want to help you use ChiroUp to succeed every single day. We want to be sure that ChiroUp is paying for itself every single month and working for you. So be sure to get a hold of us. We don't want you to feel lost at any time using ChiroUp. It's really easy to get started. Go ahead and create your first condition report right now. And if you have any questions, let us know.